Okay, Dr. Sony, please.
Good morning to all the dignitaries on and off the dais. I'm here to advocate that proficiencies in diagnostics in residents can be inculcated only through if we allow them to handle all ophthalmic instruments. That the residency training should be committed towards competency-based curriculum, and the residents of today are the ophthalmologists of tomorrow. The correct amount of hand-holding shapes them into competent clinicians. As Dr. Meenakshi had pointed out, it's the Miller's Pyramid. So Rome was not built in a day, and so the residents will not acquire this proficiency right away. There has to be certain steps which will take our time and patience to guide them through these steps. But fortunately, what do we have here? We have inherently gadget-friendly residents. Most of our residents are the Gen Y millennials, born between the years of 1980 to 95, insanely tech-savvy and confident about themselves. Well, the first years that are coming in are the Gen Z kids born after 1996, all about technology and competitiveness inculcated in them. So they already have some of these skills, not afraid to touch those machines. But the road to diagnostic proficiency, the first and foremost thing you must have is that clinical skill acquisition is the most important step. Now, as you can see on the right, IGO has told us about a list within the National Curriculum for Ophthalmology Residency Training, but in fact, very few institutes have all the gadgets mentioned in this. So we have to aim for maximum training within the limitations of our own institutes. And this includes the common instruments that would help the ex-resident turned consultant later on in a basic setup. And it would be invaluable if he was lucky enough to go to a similar or even a higher setup. Now, acquiring proficiency to use also needs concurrent knowledge of the instruments, and I have found it very facilitating to involve them if a new machine is being installed during the demo to clear their doubts and handle under supervision of the firms that are installing them. At the same time, for those machines who are already there, we have to teach the correct method, the common errors and precautions of these machines. And we have to continue with the supervision and guidance with effective constructive criticism and feedback till proficiency is attained for independent handling and we can trust them to be on their own. And we have a bail-off too. The daily workload is made easy. Dependence on specific trained personnel to handle instruments are removed, which are not available many of times, and the workload of consultants gets shared. It's good for prompt service in emergency situations, and of course it empowers these residents to train their own personnel later in life when they establish their own institutions. So a management approach where the input is the residents and infrastructure with all necessary equipments, the process being the training and use of all instruments during the period of residency, and the output we get is a good quality resident proficient in diagnostics. So our responsibility as teachers is to challenge their limits and not to limit their challenges. Thank you for your kind attention.
Thank you, Dr. Sony, for keeping it crisp. We have Dr. Sudipta. Yeah.